So your doctor removed your cast and has told you, yep, your fracture has healed. It's time to start moving that arm. But it's so painful, and even the slightest gripping action or movement is causing extreme pain. So you're struggling to really believe that this fracture has healed. In this video, I'm going to explain why it can sometimes be so painful when your cast is removed, and also how you can get that pain to calm down and get back to your normal activities. For those of you who don't know me, my name is Marika. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment of any type of sports injury, all done via video call. Have a look at the description of this video if you want a link to our website. Now, it's absolutely normal to have some pain and stiffness and discomfort when you first have your cast removed. I mean, that body part's been stuck in a cast for several weeks, so it's not going to move as normal immediately. And you may even experience like sharp pains when you take it into certain directions. But usually this pain is not extreme, and it only really hurts when you take it into those ranges where you're forcing the movement. And as your movement and strength improves, the pain usually improves as well. The pain we're talking about today is extreme discomfort. So a total disproportionate level of pain that stops you from doing most things and actually stops you from progressing with your rehab as well. Now, if this is the case, then the first thing to do is go back to your doctor, because they have to investigate this further and make sure that yes, the fracture has indeed healed properly and there's nothing wrong with the bones. Some fractures can cause complications afterwards, and it can sometimes be missed in the first instance. So it's always important to go back and say, listen, this is not improving. Can you please have a proper look? Now, what they'll do is likely order an X-ray or perhaps even an MRI scan. The type of test they order will depend on the type of fracture and what's happened in there, because different scans or X-rays can show different things better. Now, if that comes back clear and it shows, yes, the fracture has healed and your bones are nice and healthy, then we know there's nothing to do with the healing process that's the problem. And it's very likely the pain system that's been dialed up in such a way that it's now totally overreacting, and we need to find a way to dial it down. This can present in many ways. It's often combined with other symptoms. It doesn't have to be just pain that you're feeling. You can have other weird things like swelling or even hair loss in the area. Sometimes it can be a different color, that limb. Sometimes this can be called complex regional pain syndrome, but other times it doesn't really get a label. It's just called a hypersensitivity type syndrome. And it doesn't really matter what we call it, because essentially it's the nervous system that's become oversensitive and has become too good at protecting you, and we now need to find a way to dial that hypersensitivity down, that it can become normal again. So the first thing we have to do is really look at how pain is created in the body, because if you understand that process, it's going to give you the tools to understand how to dial your pain down, because every person is different and there may be other aspects that works better for you or has more of an influence in your case. We used to think that pain was quite simple. You have pain receptors everywhere in your body, you get an injury, it triggers the pain receptors or the pain sensors, and that creates the pain. But these days, we understand that actually it's a lot more complex than that, because of all the scans we can do these days, we found that sometimes people can have extreme injuries with no pain. Other times they can have nearly no injury, but extreme pain. And other times the pain reacts exactly like we expect it to. You have an injury, as the injury heals, it gets better and the pain goes away totally. So why does that happen in the perfect way in some people, and in others there seems to be a disconnect to how the body reacts? Well, what we now understand is we actually don't have pain receptors anywhere in our bodies. I know that sounds a bit weird, but what we do have is we have little sensors that's forever measuring things that can affect our tissue health. And those are things like pressure, stretch, chemicals like inflammation, for instance, heat, cold. So anything that can cause tissue damage is being sensed in the body. And all of those things are present all the time, and the sensors are forever sending little messages up to the brain. The second part of this, and I'm leaving a few of the more complicated parts out, so I'm simplifying it a lot, is that the brain then has to receive these messages and decide which ones it should listen to, because it can't listen to all of these. If it creates pain for all of this, and this is kind of what happens when it's dialed up, you end up in chronic pain. So it needs to have a threshold that if the messages passes above this threshold, it classes whatever it's sensing as potentially dangerous to your existence, and it creates pain because it wants you to take action to reduce those signals, and then it decreases the pain. So that's how it should act in a normal system. But now the problem is, we've also come to understand that it is not as simple as simply tissue damage that sets the baseline for when the body or the subconscious brain triggers pain. And I forgot to say this. It's not your conscious brain that decides to create the pain. You have no control over this. You can't just think the pain away. It doesn't work that way. This is all happening automatically. You have two systems, subconscious trying to protect you and your conscious mind. And the subconscious does not trust the conscious mind. So that's why mind over matter doesn't work for pain and usually just increases it, because the more you try to be stubborn and just push through it, the more this one goes, are you nuts? You're going to cause us trouble. I'm going to give you more pain. So please don't think of this as me saying your pain is in your brain and it's a psychological thing, because it's not. It's a true physiological thing. This is just how the pain signals work. Other things that influences the intensity of pain and can dial it up or down are things that can make your brain or your subconscious brain think that this is more dangerous or less dangerous than what the signals it's receiving is telling it. So for instance, if your past experience has told it that, nah, that type of pain goes away quite quickly, I just have to have a couple of days of rest, it'll be fine, I can run again, then it's not going to pay that much attention to that area and your pain will just calm down as the tissue calms down. However, if the last time you had pain in that area caused you to not be able to run or exercise for 6 months to a year, it is going to pay heavy attention to it. It's likely going to create more pain than what the actual injury is worth. So that's an example of a common thing that can dial the pain up. Another example in the research is whenever somebody thinks that, for instance, a family member has had cancer in the past. Now suddenly you develop pain in that same area where that person had cancer. So obviously your brain goes, oh shucks, dad had bowel cancer, now my stomach's hurting, it must be bowel cancer. And they've done studies where they've measured people's pain before they go and see a doctor. Then they see the doctor, they get a diagnosis of the injury, and they come out and they measure the pain again. And immediately, just because they now know that, no, it's not bowel cancer, it's just something else, the pain immediately drops. You can see how healing hasn't taken place while they were consulting the doctor. But what has happened is the brain or the subconscious brain has been reassured that this is not as dangerous as it thought it was, so the pain can calm down. Other emotions and things that's been shown to dial pain up is things like work stress, family stress. Stress is an interesting one because in the short term, your fight or flight reaction, like for instance, when a lion attacks you, can make you dial pain down totally, that you don't feel it at all. That's why people can lift cars up while they've got a broken arm or leg when they need to get somebody else in an accident situation, but then hours later only realize they've broken something. So in the short term, stress hormones dials the pain down and gets so that you can get your body physically out of the stressful situation. But if that stress hormone is elevated for days and days and days and days, it actually starts to increase the pain response again. And this is why chronic stress is so bad for pain levels and for especially ongoing pain levels. Other things are things like fear or anger, or if you tell yourself that, oh, I'm never going to get over this injury, I'm never going to be able to work again, I'm never going to be able, if this carries on, I'm not going to be able to help my grandchildren. Can you see how all of those thought processes is going to dial up the enormity of this situation to your subconscious, and it's going to make it more significant for you than what the actual injury may be, and therefore the pain can increase. The other interesting thing is that it's not just in this system that things can become sensitized. It's also at the level of the senses. And this can often be what I think is part of the cause with the casts, because often people who end up with pain immediately after they take the cast off will tell you that, you know what? I felt that pain immediately after they put the cast on. The doctor scanned it and said, no, the cast is in the correct place, but that pain never went away and it was there for the full 6 weeks and now I can't move my wrist. It's so painful. What we also know from the research is that if you have pain for several weeks in a specific area, you actually develop more of those little sensors that's kicking off in reaction to the signal. and they fire off more quickly and more rapidly and sends more messages to the brain. So you become better at creating the signals that then triggers the pain response as well, even in your tissue level. And like I said, I think that may be part of many of the people who end up with really amplified pain afterwards, that the cast or something was just caught in a way that kept on irritating something, and that then amplified the pain or irritated the pain signals for all those weeks and caused the hypersensitivity. Then there's another interesting aspect around all of this. What studies have shown is that they usually put people in an MRI scanner and they ask them to move a body part or think about that body part, and a different part of the brain lights up, and it's always the same part of the brain for left and right. But then when you have an injury, in some cases, that can change over time how your brain lights up when you think about that injured body part or try to move that injured body part. And they find, especially with people who develop chronic or ongoing pain, it's no longer lighting up in the same way as the uninjured side. And what they think is happening is that the brain is starting to think of that part of the body as not really being part of it anymore, and is disregarding it. And there are techniques, which I'll demonstrate in a minute as well, where they force the brain to really think about that part as part of the body again. And that then actually decreases the pain, and it starts that part of the brain to light up in a more normal way when you move that body part. So that's an interesting part to all of this as well. And then lastly, there is some evidence that in some people, it might be an excessive inflammatory reaction that's causing the hypersensitivity. So like an autoimmune reaction. Now, it's not in everybody, it's only in some people, but it may also be part of the reason why women between the ages of 50 and 70 are more prone to this, because that's the menopause period as well. And we know that some of the menopause symptoms are linked to autoimmune reactions. So if you want to summarize this, the only thing you have to remember is that all of this is happening because your pain system is becoming too good at protecting you. It's become hypersensitized. And we now have to calm it down and really work on all of the different systems that can play a part in this to get it to dial down and come back to normal again. If you're finding this information useful, please remember to hit like and subscribe. It will help our channel reach more people. The first step should always be go see your doctor. They have to make sure your fracture has healed properly and your bones are healthy. If that's happened already, then we can approach this thing from 4 angles. And to be honest, you have to combine all those things to usually get on top of this. One is we have to get your subconscious brain properly connected to that body part again. 2, we have to calm down the nervous system, both the central nervous system, how your subconscious brain feels about this whole situation, how worried it is about it, plus the little sensors in the tissue we need to also calm down, that they're not that hypersensitive. We also need to calm down the sympathetic nervous system, because that is in charge of your flight and fight response and the stress hormones, which can also amplify the pain signals. And then lastly, we have to increase the range of motion and get the strength back in that area and start using it as normal, because that helps to further decrease the whole system. Now, we can't work on any of these in isolation. We have to combine them all together at the same time. So let me explain to you how you can do this. The first thing we've got at our disposal is mindful exercise. I'm very aware how airy-fairy that sounds, but bear with me. Mindful exercise just means that rather than sit in front of the television and watch TV while doing your exercises, you actually switch that TV off and you think about what you're doing and you're paying attention to it. And part of the reason for this is that you're showing your brain, this is my arm, we are moving my arm, and it is okay to move my arm. Of course, you're not going to move it like I'm moving it now if it's painful to do that. We're going to move it in a safe way, because remember that subconscious brain doesn't trust your conscious brain. We have to do it at a level that makes it slightly apprehensive, but doesn't scare you. Because if you do it to a level that you're going, ooh, that's going to hurt, then it will hurt, because your subconscious brain has already decided that it's going to hurt. So you've got to do it to a level that you feel comfortable to do it at today, and tomorrow or the day after you can increase it. So that's the first thing, mindful exercise. Pay attention to what you're doing. Second is self-talk. And self-talk has to do with all those thoughts and worries and things that pop into your head throughout the day, but also while you're doing your exercises and doing your activities. If you catch yourself having thoughts like, I'm never going to be able to work again. What am I going to do if I don't get this function back? The thing that you're going to do is you're going to answer yourself. You're going to say, no, I will get better. I will get my function back. This is just hypersensitive. The sensitivity will calm down. So identify all those negative thoughts, all the fears. They may be legitimate fears, but identify those fears and thoughts and feelings that's creeping in, that's making you more worried. That little voice that's sitting here on the shoulder, get it to shut up, and don't just tell it to shut up. Reason with it. Explain to it that no, it will be okay. It's just hypersensitive. It doesn't like to just be ignored or told to shut up. You have to convince it. Then we're also going to use breathing. Why breathing? Well, it's the only way that they have found so far that you can actually get your vagus nerve to calm down. The vagus nerve is in charge of your fight or flight reaction or your stress response. And if you can get the vagus nerve to calm down, it actually helps your stress hormone levels to calm down, and that can desensitize the system again. And the only way to do that is through deep breathing exercises into your belly and out. So the typical yoga type things. I mean, we do it automatically kind of when we're in stressful situations. Have you ever felt how just doing that really makes you relax in that moment? So you don't have to get fancy about it. Just every now and again, tell yourself to breathe, because we often end up going like this and just having a knot in our tummies. Relax that knot and breathe, and you'll feel much, much better. So I would do this or approach breathing in a couple of ways. I would both make sure that I breathe while I'm doing the exercises and the things I do specifically for rehab. I would make sure that I check in with myself during the day that I breathe, but I will also do 1 or 2 sessions a day where I just focus for 2 minutes on breathing. So get a YouTube video about yoga or something where they teach breathing exercises and just follow that. Something else that you can do is you can start touching that injured limb. There's good evidence to show that touch and massage can decrease pain and desensitize nerve endings. And if that touch or massage comes from a loved one, it actually works better, the research shows. But when you have an injury that's this painful, often it's better if you start doing the massage and the touching first, because you trust yourself more than anybody else. I've often had it where patients are so frightened that I'm going to do something to really hurt them that I have to really, really get them to trust me before I can do anything. And I often just send them home and give them the things to do, and they come back much, much better because they've desensitized it. You do not have to do any fancy massage. Don't worry about people telling you you've got to rub it in this way or do it that way because you're going to cause damage. You are never going to cause damage with just rubbing it gently. You will feel bumps, you will feel lumps, you're going to feel tendons and all weird stuff because you've got bones and you've got tendons and it is really lumpy, especially in the wrist area. That's all normal. All you do is you get some cream and you rub it into your hand or your wrist or the area that's painful. And you do it at a level that's comfortable. Now, if it's really sensitive, you may not even be able to rub it because the rubbing action may be too sensitive. And you may have to start by just actually holding it and pressing it. But the whole time you're not doing it absentmindedly, you're thinking about it and you're just holding it and thinking about how comfortable it feels, doing deep breaths while you're doing it and telling yourself how you're helping all of this recover. So self-massage is a really good tool. You can also use vibrations, so like with a massage gun. But if you're going to use a massage gun, just have it on a really, really light setting and don't really dig in with it. We're not trying to break up adhesions or scar tissue or any of those things that people tell you you can do with it. The aim here is to desensitize, and you don't have a lot of padding on your hand especially. So if you go really hard, you can cause injuries to yourself. So on a very gentle setting, it's a brilliant tool to use, but if you're too rough with it, it can also make things worse. Then there's also heat or cold. Now, for most people with a hypersensitized pain system, cold usually just aggravates the pain more. But if you're one of the cases that has an autoimmune reaction and you've got an active inflammation going on there, then cold therapy may actually be very useful. But if you don't have active inflammation in the area, then heat is usually the better option and can be really relaxing. And what I often tell my patients is to put their body part, if they can, in warm water and do some gentle massage in that position, or do their exercises in the warm water, because it can really make it all feel more comfortable. The other thing is that we do have to start moving that limb. If you just keep on overprotecting it, there's evidence to show that that causes the brain to think more and more and more of that area of the body as not part of your body. So a big part of reclaiming this limb and making it your brain connect to that limb again is to start moving it. Now, where people go wrong often at the start is that they think they should really push it. You don't have to. If it's really painful, you just start with what it can do. And you apply all the other things I've just spoken about while you're doing it, and you just keep doing that little bits and reassuring yourself and getting it moving. So you want to work on range of motion, and your physio will help you understand what the best exercises are for the type of fracture you've got to improve that range of motion. You also want to build strength, and strength can be built through just isometric exercises. So you don't even have to start moving the joint to build strength. You can just hold contractions against your own resistance to start with. Anything that will start contracting the muscles and moving the joints can be beneficial. Another thing that's important is to use that limb for whatever it can do at this point. So at the beginning, it may be very tiny things, and you may still have to wear a wrist support or something to just help your arm. But if you can pick little things up with it, do that. You can even do that as part of an exercise to just teach yourself to pick small things up and put it into a box again. Occupational therapists are brilliant at giving functional exercises that can really help improve your function, especially of the upper limb. Other things that could be useful is going for acupuncture. It's not going to work if you're frightened of needles, because that will actually increase your stress hormones and cause your pain to feel worse. But if you're not bothered with needles, then acupuncture is something that can be useful to decrease pain. What I will say is it doesn't work for everybody, and you shouldn't just go for the sake of going. If you've gone 3 or 4 times and you haven't seen any useful improvement in your symptoms, then it's likely not going to work for you, and it's not worth paying more money for it. Also, if your doctor has established that you do have an autoimmune reaction, they may also prescribe some medications that can be really useful. And there are certain types of medication that can work for nerve pain, so they may add things like that in. Finally, it's important that you give it time. This is not something that's going to get better within a week or 2 weeks or 4 weeks even. It's going to take several months. But the good news is that even for the most extreme cases, complex regional pain syndrome, the research is showing that if they check up on these patients a year later, the majority of them has no symptoms left. So this can improve, and it very likely will improve. You just have to continuously stick with all of these things. There are some people who can actually help speed up your recovery from all of this, because they can help reassure you, give you specific exercises, and just help you create better strategies to cope with the pain and get over all of these different systems and desensitize it. Occupational therapists are brilliant, especially at wrist and hand rehab. Physiotherapists can also help with all of this. But then pain psychologists or sports psychologists can be really useful people to consult as well. We can sometimes, if you're a very strong person who are inclined to do things and get on with things, it can be annoying when somebody tells you, but your brain and your thoughts and your feelings can contribute to this pain experience. And the first reaction, my first reaction as well, is to retaliate against that. But the research actually shows that it's the type A personalities who are perfectionists and who do tend to be able to get on with things and like high stress situations, who tend to often suffer more with ongoing pain. So do make sure that you work on the mental side as well, and don't just put that aside and try to fix this from a physical point of view. Whew, feels like I rambled on a bit, but hopefully you found it useful. Now, let me know in the comments if you've got any questions, and if you need more help with an injury, you're welcome to consult one of the team via video call. The link to the website is in the description of this video. Take care.